はい、皆さん、こんにちは。アメリカ心臓外科医の北原です。新しい企画をスタートします。題して OET 対策企画です。OET とは、オキュペーショナル・イングリッシュ・テストの略で、医療従事者向けの英語の試験なんですけれども、現在USML のステップ 2CS の代替案になっていたりと、何かと、ここの領域、僕らの領域では少し小さく話題になっているテストなんですね。で、それの、OET に向けていろいろと対策をしていってる人たちっていうのいると思うんですけれども、実はチーム和田の企画の中で、イギリスに留学するって、イギリスにロッシュさんっていう専門看護師の人がいて、でその人のもとに留学する企画みたいなのが実はあるんですけども、そこに応募してきた、日本のですね北海道にいる医学生の宗像君っていうのが、OET の勉強をしながらそのイギリスに留学に向けて準備をするっていう。でその時にですね、そのロッシュさんと宗像君で、あともう一人ですね、イギリス現地の外国人、その3人でですね、この OET に関するその、医療面接の、試験みたいな対策を、していくっていうことを、するみたいなんです。でそれをちょっと動画にしてもらって、でみんなで、OET でこんな感じの医療面接が行われるんだって、英語の医療面接の動画ってなかなかないと思うので、日本人が英語でどうやったら医療面接がうまくなるのかっていうのを、訓練してる様子っていうのをお届けできたらなというふうに思います。ちょっと前置きが長くなっちゃったんですけれども、次回からは僕は前置きをしないでどんどんガンガンとやっていこうかなというふうに思ってるんですけれども、今回はちょっと説明をさせてもらいました。で、今回第1回目のケース、どういうケースかというとですね、宗像君は、こういうケースをやります。まず45歳の男性が、いて、その人は2週間前に、ハートアタック、心筋梗塞ですかね、を起こしたと。でその後退院したんだけれども、医者からはですね、次もしハートアタック起きたらもっとひどいことになるぞっていうふうに言われたんだけれども、実際例えば運動をどれぐらいしていいとか生活をどれぐらいしたらいいとかっていうことを聞いてなかったから、すごく不安だっていうふうに持ちかけられた時に何て言うかっていうことですね。非常に臨床に即したというか、よくある質問かなというふうに思うんですけれども、なかなか例えば病気、お腹が痛いですとかっていうのに対して診察していくっていうのとはまたちょっと異なる領域の雰囲気があるんで、どういうふうに答えたらいいのかって、僕もそれ見てちょっと勉強しようかなというふうに思っています。はい。ということで、宗像君お願いします。どうぞ。
That's the day 3 lesson. Thank you very much, Junior. You're coming to join us today. So
Thank you very much.
Doctors, Junior, you're going to acting in the patient. So I'm going to just check time. Okay. So we're going to try to actual test for 5 minutes. Read the scenario and 5 minutes you're speaking. But just during practice, we're going to do maybe the max half an hour. So Junior, you can give it a challenging question to Yuki.
Okay.
Okay, so I'm going to put the stopwatch. Okay, ready to go.
Okay, hello, Dr. Yuki. I'm called Judy. Hello, how are you doing?
Hello. Hi, I'm a Yuki, who is a general practitioner who is working in this hospital. Nice to meet you.
Nice to meet you too. Nice to meet you too.
Okay.
Coming today. Yeah.
Sorry?
I've come in today to see you.
Mm-hmm.
I feel I was in the hospital 2 weeks ago. I just came back 4 days ago.
Okay.
I was admitted in the hospital with a mild heart attack.
Yes.
I left. It's now been 4 days. I'm at home. And I'm very concerned because I was always a very physical person. I do a lot of walking. I do a lot of gym, a lot of swimming. And since I left the hospital,
yes,
it told me that the next attack, I'm not fear of. I might have another attack, and I'm worried some of this exercise might aggravate another attack. And my concern is like, how much exercise can I do? Because I need to go back to my healthy lifestyle.
Okay.
And what should I do? What exercise are recommended?
Sure. I totally understand, you're concerned about many things. And then, let's get started with exercise, as you mentioned. So before starting, your previous doctor mentioned anything about it?
About the exercise. It didn't say anything about exercise. He just stayed. I was in the hospital,
Yeah.
and they discharged me, and then they told me
Mhm.
the exact word was the next
Yes.
event will be severe,
Mhm.
more than the first one.
Okay. So, indeed, too much intensive exercise can trigger, another one, but it doesn't mean, you cannot engage in physical activity as you used to do. And then actually, keeping exercise on a regular basis improve your heart function, as well as, it can, it can help you prevent from having another one. So
Okay.
the thing is, what kind of exercise you should do, okay? And then I guess, the important thing is, it is better for you to start with a moderate level exercise, not intensive one.
Okay.
So do you have any idea when you hear about moderate exercise?
I'm also, like I mentioned earlier on, I've been 4 days, and I would want to go back into walking around and swimming, and probably do a bit of a cardio exercise in the gym. So my question to you is, like, when is the right time to start, and how? When is the right time to start? It's been 4 days now. I feel like
so since you released from the hospital, have you had any symptoms like chest discomfort or chest pain or anything else, or you're totally fine?
No, at the moment I'm fine. The only thing is I do smoke also a little bit, so that's another thing.
Sure. So okay.
I haven't had any chest pain or anything like that.
If you do not experience any, symptoms, as you mentioned, I think it is already good time for you to start, some exercise. And as a starter, probably walking might be the best option.
Okay.
3 or 4 times a week, and for at least 30 minutes each.
Okay.
And then as you are getting used to this level, you can develop the intensity gradually. So considering about it, swimming might a little bit too faster for it to go back. So after, after making your body used to it, you can start with swimming as well at some point. And then also you mentioned you're smoking recently. That is not good for your condition. So do you think you can stop it, or it's difficult for you?
It's very difficult unless I have some kind of support. They say something about smoking cessation is a support the hospital give, but I don't know how to access that.
Yes, exactly. Actually, we have kind of support which help you, quit the habit. And also, when it comes to support, do you know any like rehabilitation group, including exercise, in order to recover from a heart attack?
I'm not aware of any support group. But
actually, there are a number of groups or organizations which offer a big support for patients with heart attack, as like you. And then this hospital is not exception. And they are, that rehabilitation group includes a wide range of healthcare professionals, not just doctors, but also nurses, nutritionists, as well as physiotherapists. And then they can help you not only quit the smoking, but also offering a best program to exercise and like what you should eat, kind of, in order to establish a healthier life.
because it's good you mentioned that, because my next concern was because of my diabetes. I was also thinking, what could
Yes.
what kind of food, and what, they say your blood sugar, if it's too high, is also not good for you. So I just a lot of things in my life that I want to know how to deal with in order to prevent next attack, because I'm getting quite worried. I've got children as well. I don't want to leave them alone,
Yes, exactly. Tackling your diabetes also help you, help you prevent from you having another heart attack. That's very good idea. And then by getting along with that, therapist, you have a cardiac team, you can also get a lot of support about it. And then, but what I can tell you about it is, at least you can, I think it is better for you to eat more vegetables as well as nuts, a lot of healthier things, and then reduce something salt as well as something sweet, and then something fatty.
It's all sweet and fatty. I should stay away from.
Yes, I know this might be a little bit difficult for you, but it is essential.
Okay.
Do you think you can do it?
Yes, I think I can do it. I'll try. I think with the help of the support group you mentioned, if I can get with them and how to get in contact with them, I think that might help me.
After this session, I definitely make a referral to that team for you, so you don't have to worry about it.
Okay. So for now, just to make it clear, I can do small walking, 30 minutes, and hold on with the swimming and hold on with the gym.
Yes.
And do that. Another thing is with the gym and then swimming. When do you think I can resume that? I know it's probably very difficult for you to get a time scale.
Yes.
But I'd like to know, and what should I do if I'm walking and then I start feeling pain on my chest and then I start feeling tired? What advice can you give me?
Okay, so because you've already had heart attack once, from time to time you will experience a chest discomfort. But the important thing is not all the chest pains mean you are having another one. It might be just a slight symptom, and then so important thing is try not to worry about it.
Okay.
And whenever you have that chest ache, stop what you're doing, take a rest.
Okay.
And then if your previous doctor have prescribed any medication for it, just take it.
Okay.
And then just take a rest for minutes. And then I think most pains will be gone in a few minutes.
Okay.
That caveat here is that if the pain is unbearable or getting worse, accompanied by other symptoms like shortness of breath, even after taking the medications, then call an ambulance straight away.
Okay.
Do you understand?
Yes, I do understand. Thank you. Thank you for your advice.
Right.
So now it's a junior. What do you think about it? Do you have any feedback for Yuki?
Yeah, I think he did well. The good thing with what you did, I think, is you kept to the point, which was very important, because I had issues at race, and most of it were like new. I was just really ambushing you. Most of the thing you were not prepared for it, but you stuck to the point. You answered most of the questions, and then I did have to prompt him a lot for answers and things like that. And a lot of it was clear, and then and I did understand you. Everything you said was loud and clear and easy to understand, which I think is good. It's good.
Thank you.
The main point I took is because I came here thinking, wanted to come out knowing what I should do, what kind of exercise. and to what extent, and what happened if I get if I start feeling unwell while doing exercise. I wanted to know that. I want to know more about my healthy lifestyle and what you do for me by my habits, like eating, smoking, and all the thing. And you went through it and answered everything clearly. Actually, I'm happy. I'm happy with you.
From me, it's just some sentences. So just coming again for the picky feedback. Okay.
Any feedback? I'm available.
Sometimes can be when during conversation between the patient and doctors.
Yes.
Not often said in order to. That kind of stuff is not often say for the conversation. It might be on the research paper or any this could be medical documentations. You might say there's a suggestion instead in order to.
Yeah.
But sometimes when your suggestion for the patients ask the questions, you know, they had to want to exercise at what times, when would it be available, and the medication management, or the behavior management, and it just you need to be asked suggestions. If it it might be yes, I understand for doctor's order. Some patients can be well, okay, it's just a too much pushing. Okay, so sometimes
it's not like just
something also sentences. So one cushion to say, it suddenly say no. In order to, you have to do something, or it just could be, I'm going to suggest to you, I recommend you. So there's something, different sentences, alternative. You have a need at least for 3 or 4 alternative vocabulary to use. Okay.
Yeah, totally. Yes.
But actually, just during a test, and it's grammar, it's not much important for this test. Okay. How you're confident enough to speak with the patients, and you just need to your control for your temper. So that's if you're becoming nervous, you can see that some gestures are coming out, body language. Okay, that is not a really good sign. So you have to, sometimes you need to be controlled. Everyone nervous, especially test. Okay, without any test, don't worry about it. If you just start talking, especially get the license as a doctors, you need to speak to doctors patients every day anyway. Okay, but if during a test, it's sometimes body language, how confident enough to talk to with the patient, and that is most important actually. Okay. Sure. So you just need to practice. So sometimes you're talking yourself when acting patients or doctors, because if you just be as acting a patient, how you feel about it for the patient's confidence. Is it this doctor's okay, or the 2 juniors? Are you okay for to treat me? Okay.
Yeah, it makes sense totally. Yeah, I'm careful about it.
Anything else?
Thank you, Paul.
Yeah.
No, that was good. That was good. I think, like you say, the right words. You need to use the right word. Like you say, I would recommend you to stop smoking. That's my recommendation.
Okay.
Or I would recommend you to stop smoking. We've got services which can support that, like smoking cessation, which was good. And also with the exercise, you say, I've got links and support groups which can help you with how to rehabilitate after heart attack, you know, going for regular exercise. We've got people you can discuss. They have experienced the same issues. They have the same kind of worry and concern, and sitting and talking about it will reduce your anxiety, and then you will also understand what level of exercise. So, you know, group rehabilitation and things like that, like you mentioned, was good. It was a good recommendation. And like you say, you can add all that in your district summary as well.
So that's especially just the Japanese patients. If your doctor say you need to stop smoking, otherwise you're going to die, and then some people just stop straight away.
Is it?
Most of the overseas, like European Americans, it's really difficult to change for the habit suddenly, because it might be some people start smoking age 12 or 14 illegally, okay, and it just need to be now it's gonna be age 50 something, and it suddenly change their habit, never ever change it.
Yeah.
Okay. But when you talk to the patient, you have a need. Even if someone said to you, Yuki, you can't use it for your mobile phone 24 hours. No, stop it. And it's really difficult now.
Yeah, impossible. Yeah, totally.
Same thing. So that's gonna be, if you say Yuki, so you have to stop,
Yeah.
check for mobile phone in more than 10 hours in a day. So, however, you can just concentrate 4 hours in the day. You can concentrate. So just to give it the alternative options. So you just need to be option B. Okay. So that's you need to be offered to patient. If you said in order to, it's gonna be, oh my God, this doctor too much pushing. Okay. So you feel like really strong pressure. So you need your power to say to me. So sometimes even me and the juniors, when they're talking to, even I'm a line manager, junior helping my staff, but I never say, junior, in order to the teaching my staff, this. I never say that. The question,
I go, what does she mean? Why is she ordering me around?
Exactly. I'm the person to ordering him. So I can ask the offer or I ask the support. Okay, so that kind of what you say to the patient, to your colleague, you have to need to be careful to the word say.
Yeah.
Yeah, that's the point. Yes, I'm gonna be working out on.
Okay.
What's it?
Well, I'm order you to sit with lunch with me on next week.
Oh.
I'm gonna pay you lunch. Okay. So sometimes when the conversation, that's also the joke. It's just important. Okay. How to more relax the patient coming to doctors or serious heart attack. You're really nervous talking about the future. Okay. If they too much concentrate the serious talking, yes, I know you got a heart attack and you have to need to change the habit, that. It's gonna be, it feel like a really depressed, to be honest. Something you need to starting for a different conversation. Hi, Junior, how are you today? It's most English said, oh yeah, weather's really crap today, isn't it? Starting for something different. How's your life? Just starting for ice-breaking conversation first. And it started, oh, by the way, I know that you're concerned for your heart attack and you discharged the hospital a few days ago. How can I help you? So you just need to be offered to him what you're concerned and what can I do for you?
Yes.
Okay. So that kind of a
thing. Yeah. Yes, that's good. Ice break, introduce, offer, ice break, offer, and being aware of the difference between order and suggestion. Got it.
Yeah. And then sometimes you need to say a little bit of joke. Okay.
Yes. I think that could be the hardest point, but
yeah, most doctors say that. Okay. But if you just when they do their practice, and of course you don't know the junior, okay. But you said the junior, so what do you plan for it after this? I said, yes, I'll just quick go to cafe. Oh, which cafe? Oh, I like a coffee, that one. But at a coffee shop, really shit, isn't it? That kind of a joke. You just need to talk. Okay, for the short periods, you just need to be build up a little bit more pace. Okay, that's really tricky. But just you need to be how you're talking to patients. Otherwise, if you see the doctors without any C, it's nice conversation. I said, well, that doctor's really crap. It's not really talking to me, very much understand me. So you don't want to see them again, don't you? Exactly the same thing. If you go to restaurants, bad service, another one doesn't want to go back again. No, it's exactly the same thing. Okay.
Okay. I do it. Thank you. Yeah, thank you. That's really helpful. Thank you.
Thank you very much, Junior, today.
Yeah, thank you.